grassroots, not-for-profit organization comprised of patients, cancer advocacy groups, and physician practices throughout the U.S. We are as grassroots gets. And to prove that, we've obtained 25,000 patient signatures in only the last few weeks for people who are interested in fighting the cuts that have been suggested for vital imaging services today.
Currently, the federal government is proposing cuts that would further decrease 40% reimbursement reduction for some imaging services, putting more providers at risk.
In particular, mammography services are being threatened. The funding for mammography right now is so abysmal that mammography centers can only stay open because of the funding we get for MRI and CT.
This cutback is going to move us in completely the wrong direction. And it's going to put people in a place where they're going to get less screenings.
We should be focusing on extending access to these services, not undercutting these vital programs.
With high overhead, rising medical costs, and low funding, they're struggling simply to stay open. And to illustrate this point, in 2007, Congressman Weiner and Congressman Maloney sponsored a study that showed that in only 8 years, 67 mammography clinics had closed. 26% of all the closings of all the mammography clinics in the city had closed in only 8 years. And because of that now, women wait many months longer than they used to for mammography appointments.
That less screenings means later detection. Later detection, even for cancers that we now have great possibilities of treatments and even cures, later detection puts that possibility of hope really in jeopardy. So what's going to happen if these cuts go through is that the hope we now have for so many patients and their families will be gone.
This rate change could not only cost the government and patients more money, it will cost lives.
It's ridiculous that anyone in their right mind would want to continue to where we're pushing hard to get these communities to go out earlier for testing, to find out that there would be a further delay of weeks before they can finally get a test after we work so hard to get them to understand that they need to do medical intervention early.
When the federal government cuts funding, you end up cutting it for the poorest people in our city. You know, people will find a way to get an exam because you can afford to do it. But quite frankly, if we do not have this funding, we're going to lose a generation of people who will not be able to afford the test, who can't afford to wait 5 or 6 hours because they have to make a decision. I got to get to work. I got to pick up my kid.
These cuts are made, more clinics will close, and wait times will increase. This will mean that people like me will not be treated in time.
Today, we are living in an amazing time.
Detection of kidney cancer is one of the key weapons that my fellow kidney cancer colleagues have to try to beat this disease.
These services are too important, and we must not go backward in our preventative health care. There are many more lives like mine to save.
That is why I'm so disturbed and outraged that Congress is willing to make cuts and further reduce access to these amazing services.
Without easy access to sonograms and CAT scans, my doctors would have never known I had cancer, and this insidious disease would have continued to grow.
Everyone should have the same access that I was so fortunate to have.
And it is not a right. It's not humane. And as the late Senator Kennedy often echoed, quality health care is a right for all. It is not a privilege. I wholeheartedly and strongly support the efforts of the Emergency Coalition to save cancer imaging. And there should be no need for such a coalition. We shouldn't have it because this is a right. This is not something that is a privilege. It is a right for us to have good quality, timely health care.
Congress should hold this to patients in New York, and we will do everything we can in our power as doctors, as patients, and as advocates to help preserve the rights of patients and their access to medical imaging.
We must stop any further cuts to critical medical imaging services.